It's been called a vital tool in the fight against COVID-19. Though many were left shocked last month when Toronto Public Health announced it was pressing pause on a large portion of its contact tracing program. Well, this week it was announced the program is set to get back up and running once again.
Test, trace, and isolate. It is a core component to stopping this pandemic.
On October 3rd, Toronto Public Health decided to reallocate contact tracing resources because of the surge in cases. We spoke one-on-one today with the chair of Toronto's Board of Health and asked if we should have been better prepared for the second wave. Why didn't we have those staffing levels up for October? You know, we had all summer. Public Health knew what was the second wave was coming. The summer was quiet. We had time to hire more people so that we were at a full staffing capacity in October and we didn't have to reallocate resources.
Once you have a certain level of exponential growth, contact tracing's effectiveness is reduced. And so when you have case counts that we started to see early in the second wave, a strategic focus was made to focus in on the highest risk settings.
Back on October 4th, you wrote that we were past the tipping point with rapidly rising cases and transmission across the city. No amount of testing, contact tracing, and individual behavioral change will flatten this curve. Yesterday, you wrote that contact tracing and case management are key to our fight against COVID-19. Alongside accessible and available testing, this work is critical to beating the second wave. Some might read those or hear those and think that those are two different opinions.
At the beginning of the second wave, it was very clear, right, that with the rates of exponential growth, until we move to quickly reduce the number of close contacts people were having, unless we did that, we were going to be in serious trouble. And that was critical, that 28-day pause.
With COVID cases still rising in Toronto, the contact tracing pause is over with a renewed focus.
We are working towards resuming full contact tracing in our city with a proactive focus on finding events that cause a big number of infections and the people who are super spreaders.
Toronto's medical officer of health notes that they've hired 200 additional staff to their contact tracing department. I also spoke with Board of Health Chair Joe Cressy today about when he thinks the city should start reopening places like bars, restaurants, gyms. He said they should only do so when they can do so safely and stay open, saying we can't continue to have rolling openings followed by more closures. I'm Adrian Ghobrial for City News.